We begin today with that Binational Health Week. With me here on Comunidad del Valle are Sarah Cody, the new Santa Clara County Public Health Officer, and Alan Sao with the Mexican Consulate of San Jose. Welcome to the show.
Thank you.
Congratulations on being the new health officer in Santa Clara County.
Thank you so much.
And so you would know about this collaboration between the Mexican Consulate and Santa Clara County. It's been happening for many, many years. Tell us what the premise is. Why did we decide to do this binational collaboration?
Well, this is our ninth year of hosting Binational Health Week in Santa Clara County, and like many communities now across the United States, it's a chance for a great collaboration between the Consulate, the Public Health Department, many community organizations and volunteers to celebrate and to promote health among the Latino community in the county.
Is this kind of a no-brainer, Mr. Sao, given the number of Latinos and Mexican immigrants we have here in Santa Clara County, that we would do something like this type of collaboration?
It's, basically, as a Mexican consulate, we're trying to focus for the Mexican community. However, in the health banner, there's no division between countries, Latino countries, and we can give references or help to a community. We are here as a consulate on San Jose, California, because we know on the Santa Clara County San Jose has the most Latino population, and we try to focus into serve that unreached population for that they don't have any health services as well.
I'm going to take a wild guess and say that diabetes and childhood obesity are among the top topics for this week.
That's right. So just to put this in perspective, the Latino community in Santa Clara County, over a quarter of our population is Latino, but by 2050, Latinos will be the majority in Santa Clara County. So it's important that we do this right and serve the community well. And you're absolutely right, obesity and diabetes are the two biggest challenges health-wise for the Latino community, higher rates of obesity in adults and kids, as well as higher rates of diabetes.
Is this a cultural thing, Mr. Sao? Because, I mean, growing up, my mom was making frijoles with manteca, and I mean, manteca was manteca. There was no corn oil or olive oil or nothing. It was lard.
It is definitely a culture thing, but since a few years until now, the Mexican government is trying now to focus on prevention, and because we have noticed that prevention is the key to prevent this kind of illness, and we're trying to do it little by little, because it's a big change, and we have to start for later and go.
I mean, is it one of those changes that's going to take a generation to maybe teach the new generation and help them maybe once they're of older age, eating healthier, being more educated on the dangers of eating fatty foods?
Yes, and definitely if we start on earlier stages, like early ages, with the kids, with the children, it will be easier to the community to grow up on a healthy community as well.
What do you see in Santa Clara County? I mean, sorry to say, or sad to say, I should say, is maybe a lot of the folks in this community resort to emergency services because preventative care really isn't available to them. Do we see that? Is that number kind of stabilized in Santa Clara County? Is it up or down? Is there a way to gauge?
Well, our hope is also with healthcare reform that the Latino community who are not insured currently will now have access to care. And one of the efforts in Binational Health Week is to link people to care and to help them get insurance if they don't already have insurance. So some of the events involve screening, insurance screening, and helping people navigate the system to get them insured.
How hard is it, Mr. Sao, to get our folks to these types of forums and talleres and whatnot? Because we kind of put things off. We have the mañana syndrome. We'll wait till tomorrow. How hard is it to get them there?
It is hard, but we're trying to make as much effort as we can. As in this case, partnering with the health department. We trying to do it. They print out a brochure with all the information, and we try to distribute it everywhere we go. As a consulate, we have our public service area where we have some captive public where we can talk to the people and let them know about what's going on. We actually have everyday informational tables on the health matter for the people that is there to let them know what it's available on the health matter. And as a matter of fact, we have a program called Ventanilla de Salud, Health Window.
Let's save that for our next segment. I want to get into more of your Ventanilla de Salud if we can, but the Binational Health Week is happening through October 21st. I've got a couple of websites there for you. One is for the Santa Clara County government. You can log on there and kind of search for the Department of Health Services, and then the Consulado's email or website is also there. We'll be back and talk more about the Binational Health Week when we continue. Stay with us. We're back here on Comunidad del Valle talking about Binational Health Week, and you were talking about the Ventanilla de Salud, Mr. Sao, which you've had for a few years now at the Consulado. Tell us about it.
Yes, Ventanilla de Salud is a program from the Mexican government and the Mexican Health Department that created it for the migrant community here in the United States, especially the Mexican community, basically noticing about people that it was returning to our country, to Mexico. It was returning with some health issues regarding the living way here in the United States, and basically also focus on the migrant community that has no health services, and basically through Ventanilla de Salud, we can try to work with all those agencies or organizations that they offer those programs and try to refer them to the people that they don't know where they are available.
And Dr. Cody, you were kind of mentioning during the break, and Mr. Sao kind of mentioned it as well, is that it's when the Mexican immigrants come to this country, they're relatively healthy. Go ahead, finish the thought.
I think it's important to remember that one is the Latino community has some tremendous resiliency and good habits, deep in the culture. And when immigrants first come here, they're actually healthier than after they've been here 5 years, for example. So the community here doesn't necessarily always play to the health of immigrants.
So the fast food establishments in every corner have something to do with that?
Possibly, but the tradition, for example, the traditional Mexican diet, lots of vegetables, grains, beans, that's an extraordinarily healthy diet. So that, and there's many attributes of the culture, the incredible social fabric, and those are very beneficial for health. So even though we went over the very concerning diabetes and obesity, Latinos live longer than the population as a whole. So keep that in mind as well. We have challenges, but we have tremendous resilience and resources as well.
Yeah, forego that Whopper tonight and go for that nopalitos con frijoles and whatnot.
Claro.
So what's going to happen specifically throughout this Binational Health Week?
Binational Health Week is basically Mexican Consulate try to partner with many different organizations, trying to put together health workshops. Like right now we have going on health fair at the Consulate with the different tables. They give information about healthcare reform, lead problems, and different other health matters for the community. That's as good. Well, and any other different events throughout the week.
That's good work. Well, it's the Binational Health Week in Santa Clara County. There are the web addresses. Any final thoughts, Dr. Cody, before we let you go?
Well, we just hope that as many people will participate as possible. We hope it raises awareness, links people to services, and also it's a time for celebration as well.
All right. Well, thank you so much for the work that you're doing for our communities here in Santa Clara County.
Thank you.
Thank you.
Right. And up next, you're on Comunidad del Valle, how to get into college, how to pay for college. We'll set it all. Stay with us.